cell tower radiation is an environmental exposure in need of federal accountability, termed a new form of environmental pollution, although rather not so new as it seems, but one of the most rapidly increasing environmental exposures, I think, in the history of the world. You imagine just a mere decade ago, how many of us, or 2 decades ago, were using devices as we are now. All phones are connected with cell towers, so these wireless networks are proliferating. Because it's invisible and the lack of accountability, which I'm going to describe, we're in a situation where the limits that we have, as Courtney said, are from 1996. And although levels are increasing, involuntary nonstop exposures from cell towers, the ambient levels of radio frequency radiation levels that we're exposed to are increasing. We don't have an agency in charge of monitoring or assessing the situation. And we end up in situations like this. This is right near my home. It's a cell tower right near Wheaton High School. Even the companies themselves define wireless radio frequency radiation as a pollutant. If you buy the Verizon Total Mobile Protection Insurance, actually it says that they don't insure for, they exclude if it's from pollution, and pollution is described as vapor, soot, fumes, chemicals. I'm going to fast forward: magnetic fields, electromagnetic fields, sound waves, microwaves, which is radio frequency radiation, and all artificially produced ionizing or non-ionizing radiation and or waste. This is a cell tower disguised as a mushroom. It's got this facade on top of an apartment building also near my home, and these situations are egregious. Now, cell tower companies warn shareholders of the risk, but they don't warn their neighbors or the consumers of their devices. They say in their 10K filings, our wireless business faces personal injury and wrongful death lawsuits related to alleged health effects of wireless phones or radio frequency transmitters. We may incur significant expenses in defending these lawsuits, and in addition, we may be required to pay significant awards or settlements. And in fact, there's exclusion clauses for electromagnetic radiation as industry standard in many insurance policies, and it's rated as high risk comparable to asbestos by insurance company white papers themselves. So we were sent this picture. Environmental Health Trust, we're a scientific think tank, and we're contacted all the time by stories much like Courtney's and the community of Pittsfield. And these couple asked us, is this safe? Is this okay? We've been having these sleeping issues and so forth, and do you have research, and what do you think about this? And sent me all of these pictures. I have actually a whole library of pictures that people have sent me of the towers near their homes. But the real question is what agency ensures that cell towers are safe in the United States or in other countries? What levels of review have they done? There is no agency ensuring cell tower radiation is safe. There was no pre-market safety testing for wireless networks and wireless devices and so forth. There's no pre-market surveillance for health effects from cell tower networks, people who are living near towers. There isn't an agency checking to see how their health is in any systematic way, and certainly not funded by the US government. There's no reports or reviews on long-term exposure. There never was any information on long-term exposure to cell tower networks before they were designed and brought forward and installed. And there's no monitoring of the radiation levels in the country, the wireless radiation, or even the magnetic field, extremely low frequency fields, not since the 80s when the EPA last did a report on this. There's no budget in any agencies to address this issue and the totality of the issue. No government staff. When I first learned about this, I thought for sure that there's all of these scientists, they're sitting around, they're reading the studies, they're making sure that me and my family are safe. But that was an illusion that I believed. And there's a lot riding on that assumption. That assumption is used by industries who are putting forward this technology. And we find it hard to believe that There's been no review of the totality of the evidence, not by any of these agencies, not by the EPA, the National Cancer Institute, the Department of Labor, and employment issues and occupational issues are still important. Hopefully, maybe another session we'll talk about that. Not by the CDC, despite their website, not by the FDA. There's been no risk or hazard assessment for health effects based on the totality of the science. No review of whether FCC limits are safe from harm of all health effects by any U.S. regulatory agency with health or environmental expertise. And that is our situation. And brought back by popular demand, I just want to review what the FDA told a California mother who contacted the FDA after the FCC said, that cell tower on your street is safe because it meets FCC limits. And the FDA deemed those limits as being protective. And the FDA wrote back, the FDA does not regulate cell towers or cell tower radiation. Therefore, the FDA has no studies or information on cell towers to provide in response to your questions. This University of Pittsburgh Law Review, which came out last year, it's entitled, "The FCC Keeps Letting Me Be, Why Radiofrequency Radiation Standards Have Failed to Keep Up with Technology." And this is a discussion of the policy and the failure of these federal agencies to create safe guidelines that protect the public. And this wasn't mentioned, so I had to mention the captured agency, because this sort of ties all the pieces together. I mean, how did this happen? I know I asked myself, well, wait a minute, we're all using cell phones, there's cell towers everywhere. There's, in my community, we're getting towers 30 feet from homes with no say, no notice, no nothing. This is happening across the country. And this Harvard report from 2015 documents how the wireless industry is using the tactics of big tobacco. Not only are they involved in the science, but there is millions of dollars into Congress. The FCC is captured. We have former industry leadership who is at the leadership of the FCC and actually paved the way for the situation we're in now. So I recommend that because they explain how we sort of got to where we are. And in conclusion, the National Cancer Institute has not done any review, systematic review, or evaluation on the issue of cell tower, cell phone radiation at all. So this is confirmed in several ways, of which I'm going to share. Denise Ricciardi, who was on the call earlier, had written a letter to the National Cancer Institute. And in the New Hampshire State 5G State Commission, you can go in and see the email communications between the New Hampshire Commission and the National Cancer Institute, in which they confirmed, when she asked, what is the National Cancer Institute's opinion on the safety of 5G, 4G, and cell towers, that as a federal research agency, the National Cancer Institute is not involved in the regulation of radio frequency telecommunications infrastructure and devices, nor do we make recommendations for policies related to this technology. Our sister agencies, the FDA, as well as the FCC, retain responsibility for reviewing guidance on safety concerns and informing the public if these circumstances change. Now, I had written the National Cancer Institute earlier because my local school board had told me the same thing. They said, well, the National Cancer Institute says it's safe. They say it right on their website. And I have documentation and letters where they communicate to me that neither the literature reviews nor the fact sheets make safety determinations. So as I'm going to be talking about, there has been no review of all of the research by any federal agency with expertise in health and environment. So let's look at also the World Health Organization. The link goes to the EMF project site. Now, I don't have time to go into it, but there's actually two entities at the World Health Organization. It's under the umbrella of the WHO, but there are two separate entities. One entity is the EMF project. They have not done any reports, research reviews, or determinations since 1993. The Berkshire Eagle opinion piece goes to this page on 5G. And if you actually look at it and click on it and go to what is the WHO doing, they talk about how they are doing a review that should be published in 2022. And if you continue to say, well, oh, they're doing a review, well, when did they last do a review? It's actually 1993 that the World Health Organization EMF project last did a health risk assessment. Now, there's all kinds of issues around conflicts of interest that I can't go into that have to do with this particular entity at the WHO. But remember that the International Agency for Research on Cancer, which is under the WHO, did classify radiofrequency radiation as possibly carcinogenic to humans in 2011. And since then, numerous experts who actually served on the WHO, International Agency for Research on Cancer, working group, the scientists that got together to make that determination, have determined that the science is robust enough to determine that radiofrequency radiation is at least now a probable, if not a proven carcinogen. Dr. Christopher Portier, who's the retired director of the United States Center for Environmental Health at the CDC, who served as an expert to the WHO and also retired director of the agency, US Agency for Toxic Substances and Disease Registry. He filed a report in a lawsuit with a actually, there's several people who have brain tumors they're alleging are from the cell phones. And in this report, he states that the science is enough to determine that the probability is high. There's also Dr. Leonard Hardell, who has published many papers concluding that radiofrequency radiation is a human carcinogen. So what of the EPA? Well, the EPA did have a robust review research program that they were doing for many years. In fact, what I'm showing you is slides from a presentation that they did to the FCC. They were developing safety limits for radiofrequency radiation, and they would be based on health effects, and they were fully defunded from doing that. When the Telecom Act was passed in 1996, one of the most heavily lobbied bills in the United States ever, I think. I think it's actually ever, certainly at the time. And they were fully defunded, and the FCC, as discussed, took on the limits from industry groups. Now, when you go to the EPA, it's actually all goes to the FCC. All the web pages were scrubbed, updated. They don't have any report that the EPA itself has done, but instead simply parroting FCC language. Then we go to a letter that the EPA wrote me, because I wrote the EPA and I asked them, what is your stance? Have you made a determination? Because everyone seems to think you have. And I actually got a letter from attorney Leanne B. Veal. She's the director of the Radiation Protection Division of the Office of Radiation and Indoor Air at the EPA. And she said, the EPA's last review was in 1984, and we don't have a mandate for radiofrequency matters. And she answered all of my questions, basically saying, we haven't reviewed it, but we've made no determination. So what of the National Toxicology Program that was cited in the Berkshire Eagle? Well, they looked at this issue with a $30 million animal study, and they were asked by the FDA to do that because there was inadequate research on long-term exposure, and they were asked decades ago. They finally came out with their findings, which were that there is clear evidence of tumors in the hearts of male rats, some in the brains of male rats. There was damage to the heart, and there was also DNA damage in tissues of the mice and the rats. This is a quote from Dr. Linda Birnbaum, who filed a statement in one of the amicus briefs. And she said, overall, those National Toxicology Program findings demonstrate the potential for radiofrequency radiation to cause cancer in animals. And also, I don't have time to present all of this, but Dr. Ronald Melnick, who led the design of the National Toxicology Program study, also has published numerous papers and given many presentations. You can go online to watch those, talking about how the study is important. It shows that there are non-thermal effects and there needs to be reductions of exposure to protect the public.
What does the public need to know? There have been multiple studies have found increases in cancer associated with exposure to radiofrequency radiation. This is animals and humans. Because of the widespread use of cell phones, even a small increase in cancer risk would have a serious public health impact. I strongly feel precautionary principles should be promoted by health and regulatory agencies, especially for children and pregnant women. The agencies in the US say, if you are concerned, that puts the burden on the individual. It doesn't say, we are concerned. It should be very straightforward. Precautionary principles should be promoted because, as mentioned earlier, risk can be greater for children than adults due to the increased penetration of the radiation within brains of children, and the developing nervous system is more susceptible to tissue damaging agents. So finally, what is the lesson that should be learned? When dealing with assumptions, I think we've shown that assumptions in this case can be wrong, so that we should no longer assume that any current or future wireless technology, including 5G, is safe without adequate testing.
Some people bring up the American Cancer Society, except the American Cancer Society also has not done any review of research on cell towers, and they've done no review of how protective or not protective FCC limits are. In fact, the website, oh, and I should say, I had communications with both medical directors, Otis Brawley, as well as the current medical director, testifying to this, because we specifically wrote and asked, because all the time, when people are asking about the safety, the American Cancer Society is brought up as somehow giving the stamp of approval for cell towers. But in fact, they haven't looked at all of the science and systematically reviewed it to determine, at what level is there harm, how much radiation are people exposed to from towers, and how does that compare, which you hear about related to water quality or air pollution. We hear about, what's a safe level? What's a safe level for kids? What's a safe level of lead? Of course, there's no safe level of lead because it damages the brain. None of that has been done in regards to cell tower radiation by our regulatory agencies. And the American Cancer Society actually says they don't have an official position or statement on whether radiofrequency radiation from cell phones, towers, or other sources is a cause of cancer. And actually, that's probably because of our letter to the ACS and the board due to all of these statements brought forward that somehow the ACS is okaying it. They also say that on their website that they'll look to other expert organizations to determine if something causes cancer. And they list the International Agency for Research on Cancer and National Toxicology Program, both of which actually have found links to cancer. Now, when the National Toxicology Program found clear evidence of cancer, the American Cancer Society referred to that study in their press release as paradigm shifting good science. And of course, the Ramazzini Institute did studies looking at a much lower level of radiation comparable to base station antennas, and also found the same tumor types as the National Toxicology Program. But cancer is not the only harm, as going to be discussed. Countries with cell tower radiation limits far more stringent, much lower than the United States, are Italy, Switzerland, China, Russia, India and Israel, Turkey, Bulgaria, Brussels, Belgium, and many other countries in Europe and in Eastern Europe. And that what I'm referring to is the amount of radiation that's allowed. So when a tower goes up, what's that amount in the air that is considered allowable by the government? Many countries have much more stringent levels. They are not necessarily fully protective yet, but they are much lower. And in fact, several localities in other countries don't allow cell towers near homes. They consider, in schools, they consider neighborhoods, schools, hospitals as sensitive areas, and they have more protective laws where people live, work, and play. In India, after a review of the science by an interministerial group, several different ministries, they actually dropped the levels to 1/10 of what it was before. This is Juhi Chawla. She's actually a former Miss India. She's a Bollywood actress, and she's receiving the Indira Gandhi Memorial Award for her work on raising awareness on cell tower radiation. Because on the last few years, she's been working on this issue of raising awareness after cell antennas were placed up across from where she lived.
We wouldn't want that 20 years down the line, we have an entire population of young children, young adults, old, suffering from various health effects due to our negligence, our inaction, or our ignorance. ये उन्होंने तब कहा था.
Radiation from cell towers, which have been mushrooming up in our city, on top of residential buildings, near schools, on top of hospitals. The cause that I have been involved with and I would like to spread awareness about is the harm that this can do to our health. 14 mobile cell towers came up almost overnight. We wrote to the Chief Minister once, twice. They did reply, but they told us to address our concern to Mantralay. We put up banners outside our building requesting the Chief Minister to take notice. The press all came, they all wanted to know what it was about, and literally within 2 weeks all the towers went. This is happening not just in Mumbai in front of my house, it's happening opposite practically everybody's house.
It is going to affect everybody, the men and the women, the children and the old, the rich and the poor, the people in the city and the people in the villages. And not just all of us. This radiation, which was not there 15, 20 years ago, is going to also affect our environment, our birds, our bees, our flowers, our farming.
In India, in many communities, there are setbacks related to or not prohibitions for cell towers near schools. So in this slide, I'm talking about school districts where the Los Angeles, California School District has resolutions opposing cell towers on school property. And they even have a cautionary level for radio frequency radiation 10,000 times lower than FCC limits. Palo Alto Unified School District, Westland, Wilsonville, Oregon, Vancouver School Board, Montgomery County, where I live, they now no longer allow cell towers on elementary school property. Prince George's County, where I live, actually I lived in both counties and it's kind of a part of these situations, but that we had a leasing agreement where all the schools were marketed as cell tower sites. And that is no longer the case. The board decided not to renew that agreement. And that took a lot of work and determination by members of the community. So in addition to levels that are different in terms of how much we're allowed to be exposed to, there are many countries that measure the levels of ambient radio frequency radiation from cell towers, post them publicly. Some of them have 24-hour monitoring stations. What you're seeing here, this is actually Switzerland. They have a map online. Each of these little dots, you can click on it and see what is the level in that area and how does it compare to their limit. In the United States, we don't do that at all. Many people struggle to figure out, well, what is the level near my home? They go through a lot of work, which really there should be far more transparency on this issue, as many other countries are doing. So in the United States, we have no federally developed safety standards. They're really not federal safety standards because no US agency actually developed them. They weren't developed by the EPA, which was tasked to be developing them, but was defunded from doing so. And in 1996, the FCC adopted limits for radio frequency radiation. Those were based on industry-filled groups. In 2019, they affirmed those limits, and that is when we filed against the Federal Communications Commission, along with Children's Health Defense and several other individual petitioners. And in 2021, the court ruled that the FCC's decision not to update or to affirm these limits, the FCC limits, that it was arbitrary and capricious. And they ordered the FCC to explain how the limits address the impacts of radio frequency radiation on children, because they hadn't responded to the tens of thousands of pages of science on the record showing impacts because of children's vulnerability, as Courtney discussed, and the implications of long-term exposure and the new technological developments and impacts to the environment. Now, we filed in November, and actually also just a few weeks ago, additional research to the FCC, urging them to do a robust review of the latest science. And that was signed by Dr. Linda Birnbaum, former director of the National Institutes of Environmental Health Sciences and National Toxicology Program. Actually, many scientists signed on: Deborah Davis, president of Environmental Health Trust; Ronald Melnick, he's a NIH scientist for 28 years. Dr. Jerome Paulson is a former chair of the American Academy of Pediatrics Environmental Health Committee, and many other scientists. And yet we haven't heard anything back. And I think that it's really outrageous that we have this growing exposure, but no full review, no due diligence on the issue to ensure protections for people in the environment.